Welcome to the Global Health Equity Miniseries. I'm your host, Harvey Kennedy Pitt. Join us as we look at 8 public health principles that can help health systems build capacity through adaptation. And good morning, good afternoon, good evening, Tendai. It's such a pleasure to have you on this series of the Global Health Equity Miniseries. So can we just jump right in and start with an introduction? Who are you? Where are you located? What's your role, background, etc.?
Okay, good day, everyone, and thank you so much for having me. My name is Moreblessing Tendai Javangwe. I am Zimbabwean, born and raised in Zimbabwe. However, in 2008, my family relocated to South Africa, and there I stayed with my family for approximately 14 years. Then in August 2022, I made the decision to uproot my life and come to Thailand to pursue my bachelor's degree. I am currently pursuing my bachelor's degree in Bioscience with an emphasis in community public health at Asia Pacific International University. So, a bit about myself. During the past 3 years here at Asia Pacific International University, I've been involved in a lot of community outreach. I've had the opportunity to work with many populations, particularly the elderly. I've also worked with adults and young adults in Banmark, which is a neighboring village. So I've had a lot of interactions with different populations. However, for today, I'll only talk about 3. And the first one would be working with the elderly at the local school for the elderly. So this is an ongoing project that was started by my classmates and I under the supervision of our instructor, our lecturer, and our advisor, Dr. Maxine Newell. So we started this project in January last year. So what we'll do is we'll go to the elderly school, interact with them, give them questionnaires and surveys, and we're able to gather the information or gather data. And using this data, we're able to structure our intervention so that it can meet and address those needs. So we're trying to educate them about non-communicable diseases, and the ones we're looking at were hypertension and diabetes. So we're able to have fun little activities for them, give them snacks, teach them how to exercise, and this will all help to teach them about how to prevent and manage diabetes.
It sounds like very
So
traditional public health in many ways, that you're practicing there. And this is only at your bachelor's level. That's amazing that you're already learning how to do sort of public health in this way in the community.
yeah, it's been a really awesome experience, eye-opening. It's taught me a lot, actually. So with this information, we're also able to go out into the village. After we've gathered some information, gotten some experience, we went out to the village, and this is also another ongoing project, which we do every Saturday. And we go out, we interact with the elderly, the adults, and the young adults there, and we do the same thing. We collect data, we help them, we educate them on diabetes and hypertension. And we also have little activities showing them how to exercise. And at the end, we had pre and post surveys. We had a pre survey in the beginning and a post survey at the end. And this is basically to see if what we're doing has had an impact, if the information we're trying to give them has been well received. And we also got some feedback and we're able to see, oh, okay, here we can change our strategy or we can do this to make sure it reaches them better or we can address their need in a better way.
Which is really cool because actually in public health, we think we're just going to go out. There's a tried and tested method. We go into communities, we, do our needs assessment, we start the interventions, we might do a bit of pre and post, but we don't do the reflexive practice bit. And I think that's what you're referring to as being a reflexive practitioner who kind of goes back and says, how good of a job was that? And maybe we can change some things about it. So very culturally humble approach rather than a kind of parachuting in and being the hero type of approach. So, so yeah, that was a really comprehensive overview, and I think that it demonstrates you have a good understanding. And as you get to the end of your degree now, and you sort of transition into a new phase of life, it's you'll be taking quite a few skills with you, and particularly even the ability to articulate what it is that you're doing. Well, all of these things don't just come from nowhere. They're built on principles. And anyone who's been watching this series, whether series one or series two, will know that this entire series is built on a set of principles, public health principles, such as autonomy or participation or accessibility, amongst others, sort of all related to equity. And I'm wondering which one of the principles really spoke to you and is the one that you'd like to speak about today, or sort of focus on today.
Okay, I believe that all of them are equally important and they're necessary for public health. But if I had to choose one, it would be equity. So making sure that everyone has equal access to healthcare and health information, because I believe that with our work, we're working a lot with the marginalized populations. So they present their own unique set of risks and needs. So it comes to our role as public health practitioners or public health professionals, or even aspiring public health professionals, to look at those needs, to assess those risks and see, okay, what can we do to make sure we're able to meet that risk and improve the health of the population.
Absolutely. I mean, equity is a great one. I'm curious and it might be my limited knowledge of Thailand and sort of that region, what makes those particular groups marginalized? Because I guess people think, oh, it's quite a relatively homogenous society. We know there's always like class system stuff or, kind of access to healthcare or education bits. But what sort of makes that group or the groups that you've mentioned marginalized within the context of your work?
Okay, so I believe there are two main factors. The first one is the elderly. So the elderly, we tend to neglect them in some in a sense they are neglected and they do not have that access to healthcare, so they are very dependent or reliant on relatives to look after their health for them. So when we do health education, we're making sure that we equip them with that knowledge so they can be able to take care of their own health. And the second thing is that most of them are like the ones in the village. They do not have a hospital or a clinic nearby. So it comes to our role as community health workers when we can go out and help them and provide them the healthcare that they need from the comfort of their own homes. Because we'd literally be going out into their homes, we'll be sitting with them in their own homes, and we're able to help them from the comfort of their homes.
Okay, so there's a bit of an access, issue there as well, which surprises me because I think you'd speak about accessibility today, but that's okay. We can talk about equity. And I guess my next question there would be, what problem would you say that you're trying to solve through the work that you do, even as a
Okay. So for me as a student, the main problem which I'll be trying to address would be health education.
student?
So it comes to the point where so often we go out in the communities, we have these great ideas of these big interventions we're going to do. We've poured hours into organizing them. And at that point, we have failed to properly assess the needs, the health education needs of that community. So it comes to a point when we do a lot of speaking and we don't do a lot of listening to the
Hmm.
community. And to the point that when we leave, the community is the same way as we came. So they have not had any education. So essentially, we have not helped them to get equitable health access, which is what we're striving for. And when we think of interventions, most of us picture us going out helping a huge group of people or thousands of people speaking to a large crowd. And we forget that even those small populations or the small communities that are usually not considered a lot, we should not leave those communities out. We should not neglect them. So the main problem that I'll be trying to address is health education. So often we go out into communities with all these wonderful ideas or big ideas of the interventions we're going to do. And most of the time we do not do proper evaluation or assess the needs of the community very well. So we do a lot of speaking and we do not do a lot of listening. So at the end of our intervention, we leave the community and the members of that community are still the same way we came. They have not had any increase in health education or what we're striving for, which is health equity. They have not had that essentially.
Mm.
So, and also when we go out into communities, most of us think of when we say intervention or community outreach, we want to have a huge group of people, want a lot of community members to come, maybe thousands of people, have big gazebos and everything. But sometimes we fail to recognize that even if you go out to say 10 people and you provide that education and they're able to receive it well and understand it, and it can help to improve their health, that is what health education is all about. And I believe that it comes back to our part as public health practitioners to make sure we can achieve that.
Which is really interesting because there is always an ongoing battle between the quantitative approach and the qualitative approach. And, we with the quantitative approach, we want to know how many people did you talk to, in these brief advice interventions sessions. How many? Was it 50 people? Did you talk to 100 people? And then we say, oh, look, impact. Great impact. Do we make a note of it and we type up a nice little article and then we go to funders and we say, give us more money because we talked to, 100 people. With qualitative approaches to research anyways, we want to understand the meanings and sort of go deeper, and I think we spoke about that in a previous conversation. And so that's even what I'm hearing in the example that you're providing, is that actually it's quality health education is what your focus is, not numbers and how many people you can say that you taught at but people that you connected with, and some of the conversations that you're having, which I would say leads nicely into my next question, which was, you're focusing on equity and the work you're doing around health education. But I'm wondering if you could take that a bit further and tell us how we can make traditional approaches to education and community engagement more meaningful. And I think you started to talk about it already, but maybe you want to take it further.
Okay. So, as for me, I've had the privilege to stay in a few countries, namely South Africa and Zimbabwe. So, it's a country that is not my own. So, what I've noticed is that there is a pattern of we have immigrants, marginalized communities, and other vulnerable populations experiencing barriers that can limit their health access. So, it comes to us as how can we bring them closer to healthcare in a sense? And the reality remains that health equity is one of our unmet goals in the
Mm,
healthcare systems all around the world. And when vulnerable populations are excluded, whether it's intentionally or non-intentionally, they experience more health risks. So they have higher risk of preventable disease, they have poorer mental health, and they have reduced access to the preventative strategies. So what we can do is we can make sure we assess and we find the barriers that are there and see
mhm.
how we as public health can make sure that we can bridge or remove those barriers and make sure that our interventions meet the demands of that community.
So there's a bit of assessing for barriers, but also, I guess, doubling back and checking on yourself and kind of saying, are we making any impact? And that's a big one for public health because and one of the things that drove me back to these principles in when I started this consultancy was that we were doing so much public health and population health, and we were doing all these health things. But if you asked most people what the principles were of what they were doing, they couldn't tell you what the basic principles of public health were. And that's because I guess public health systems are structured very differently around the world. But I guess the meaningful element is acknowledging that there are barriers, and that might be collecting some data, it might be trying to do some fact finding, some needs assessments, but identifying specific barriers that you're trying to address and then mapping any interventions or programs across directly to those barriers. Once you've done that, do the intervention, then double back around and kind of, dare to ask, what impact have I actually had here? And if I haven't had impact, be honest about that. I think that's always very helpful. Would you say that's what you're saying?
Yes, essentially that's what I'm saying.
Okay. Okay, very good. Well, I think it's very interesting that you've been sort of Zimbabwean raised and then South African transplanted and then, over to Thailand now. What's next? Where are you going next?
Next is Georgia for
And
med school.
that's the country Georgia, not the state, the American state Georgia, right?
Yeah, the country Georgia.
Yes. Okay. And so we've been speaking about public health, which focuses on populations, it focuses on health education, promotion, looking at data. Uh, so why medicine now? Why the pivot to
I,
medicine?
I believe that medicine has been something that I've wanted to do for a very long time.
Okay.
It's something that I have a lot of interest in. So I believe that even though public health is important, it's something that's very dear to my heart, I can, in my capacity, have more impact in the hospital.
Okay. Okay. So you've thought through it. That's what you think, you can have more impact in the hospital.
Yes.
Okay, good. There's definitely a relationship and a partnership between clinical services and public health services. And I think anyone who's able to straddle both and kind of understand both can become a really big advocate for that relationship. I think oftentimes we have clinicians who have only done clinical medicine, and then we have public health people who have only ever done public health, and they're both speaking, but no one is listening. And therefore, we're not able to form bridges and partnerships that can create the greatest impact for populations and the individuals that make up those populations. And so I'm really looking forward to seeing and understanding how you're going to bridge those two things as your career develops. You're just a student, but you're so very articulate in your expression of these concepts, and I'm really excited to see where that goes for you.
Excited to see where the road will lead me.
Yes, absolutely. And anyone listening, they will be inspired by your story, your background, just the fact that you've moved around. Many people have never left their geographical location. They've not been able to do it, or they haven't taken an interest in doing that. And they gain quite a bit of inspiration from those who have moved around and traveled around the world. I think I saw a stat today that said only actually 80% of the planet have never been on a plane, and you realize that that's
Wow.
at least only a small, I don't know how true that is, so don't quote me. But I thought, someone thought to put that data together, which reminds us that actually jet setting and moving around the country and creating impact is still quite niche, on a global population level. So, it's the work that you're doing and, how you've done it is amazing. And you should be very proud. But what would you say a key call to action might be for those who are listening? So they've heard your story, they've heard your example, they know which principle you're focusing on, but maybe there's a specific call to action that you want to sort of emphasize that we don't forget.
Okay, my call to action would be everyone can do something. So even if it's the little that you can do, it doesn't have to help to happen with like maybe a huge population. Do the little that you can. So if you're able to improve the health of even like 10 people, it is okay. When that change in small amounts accumulates over time, that's when we can reach that goal of what we're all trying to achieve as public health, to make sure that there's equity, there's healthcare access for everyone.
Yeah.
So everyone can do something.
Absolutely. That's a great call to action because I think that people feel they have to do something really notable or something really massive. Like you said, speaking to 1,000 people and, come back and say how they talk to 1,000 people. But actually, there are people next door. There are older people next door to us. There are young people, we interact with every single day, who could do with an encouraging word or, an in question to help guide them on their way. Those are interventions that are related to public health as well. Public health is very broad. And so, any community action that you can take is just as valuable as something that has sort of global sort of reach. And so that's a really great call to action. Now, I know that you're going to be transitioning out of Thailand and into Georgia in the next several months. But there might be people who want to follow your journey, or they want to just be able to get in contact with you and ask you, how did you do that? I want to go study medicine in Georgia, or I want to go and do public health in Saraburi, or whatever it is. How can they get in contact with you? Is there a way that they can follow your work or get in contact with you?
Okay, so the first thing would be you can follow me on LinkedIn and we can talk on LinkedIn. My account is Tendai Javangwe. Or if you want to follow along for my journey, see all the cute reels and all the nice moments, you can follow me on Instagram at Moreblessing Javangwe.
Amazing. Okay, so I'm excited about the journey ahead, and we'll be definitely following to see how things develop for you because I know the potential is there. Your willingness to even be on this series as a student and someone who's still learning but has so much knowledge already, is inspiring. And I hope that it's not just been inspiring for me, but it'll be inspiring for all those who watch the series as well. So I'm impressed already, impressed, impressed, impressed. And actually, you'll be doing your very short internship with us before you transition into medical school, and that's really exciting as well. So I'm looking
Yeah,
forward to working more closely with you and learning from you and hearing your perspective on things as you look at some of our programs of work. So that's very exciting. Well,
I am excited also.
very good, very good. Okay, that's what we like to hear. Well, thank you so much for your time today on a weekend because that's when we got some time in to record this. And I wish you all the very best with the next steps.
Thank you so much.